Health Today is brought to you by
Super Shirtox gets insects for sure.
In this edition of Health Today, we take a look at a disorder which can affect children, cerebral palsy. Cerebral palsy is a leading cause of childhood disability worldwide, affecting 2 or 3 out of every 1,000 children at birth.
This is a disorder where you have abnormal movement, abnormal posture, and it results from an injury to the immature brain, so hence occurring in children. There's pretty much 3 stages that people kind of break it down into when this injury or insult to the brain actually occurs. So in medicine, we would say prenatal, which is before you're born, perinatal, which is around the time that you are being born, so around the time of delivery, and then postnatal, which is after you're born, and that can go up to about age of 3.
Cerebral palsy is a disorder we don't often talk about in Barbados, but it is a reality for several families.
A recent visit to the Cecil Albert Graham Development Center, formerly called the Children's Development Center, you would always see children over there with cerebral palsy. We also have some on the Evelina Smith Children's Ward at the St. Philip District Hospital. Some of them, probably went there when they were really children, like under the age of 18, but then actually remained there even when they got into adulthood.
According to Dr. Shane Drakes, the exact causes of cerebral palsy aren't always known, but he says it can be identified as early as from the womb.
If it's prenatal, there's things like infections that could be passed on from the mother, abnormalities with the placenta. Some babies, when they're in the womb, they actually have bleeding or stroke, bleeding to the brain or stroke while they're in the womb. That can happen. Also toxins, which might be medications or other toxins that the mother might ingest, might pass to the baby. And then sometimes, you just have abnormalities of the brain or abnormalities of the blood vessels in the brain, which could be due to, like genetic problems and things like that.
There is no cure for cerebral palsy, but treatment, therapy, special equipment, and in some cases surgery can help children who live with the condition.
But you really need a team approach. You really need a team of different healthcare providers to actually properly manage this. So definitely, a pediatrician has to be involved. I think that's like number one. Therapists, the different therapists that would need to be involved. So usually you will have physical therapy, occupational therapy. Some of these children have trouble with speech and so on, so a speech therapist will be involved. In the U.S., they have something called early intervention, where any child that's diagnosed with developmental delay would automatically be enrolled in this program, where they would get intensive therapy immediately, and that would even take place in school as well.
Here in Barbados, the Albert Cecil Graham Development Center provides significant support to children affected by the disorder. Dr. Drake says children living with the disease should not be abandoned. He says families and caregivers should seek to provide them with the best care and lots of love and support. As a rehabilitative specialist, he looks after their needs.
They probably will need some kind of medical equipment, whether as a walker, probably need braces, many braces to help them walk properly. Sometimes they develop contractures and so on, which is basically a shortening of the muscle in a certain position. So you need to refer them to the appropriate person to deal with that, and educate the parents and get them in therapy to actually prevent that from occurring in the first place. They also usually have abnormal muscle tone, so increased muscle tone, what we call spasticity. And again, you need to put measures in place to prevent that from becoming a major problem, or if it is a major problem, deal with it adequately and early.
While cerebral palsy remains a major challenge for children living with the disorder, with adequate care and support, some will develop enough skills to live almost independently, have jobs, and even compete at the upcoming Paralympic Games. After all, disability is not inability.